One reason that you may come to an ENT's office is for chronic sinus infections. The sinuses are hollow cavities in the face. You have 4 of them: the frontal, the ethmoid, the maxillary, and the sphenoid sinus. And often, because of allergies or chronic inflammation of the nose or a chronic infection, the openings of the sinuses can become clogged. If you have an acute infection where you have yellow-green drainage for less than 10 days, it's often caused by a virus. If it's more than 10 days, it's often caused by a bacteria, and you're going to need antibiotics to treat that. Chronic sinusitis is like acute sinusitis, it's just that it lasts for up to 3 months. Or you could have 4 to 6 infections in a year, and that's also a reason that you need to see an ENT doctor to be evaluated for chronic sinus problems. So what can be done for recurrent acute or chronic sinusitis? Often you'll be evaluated and placed on nasal sprays such as a nasal steroid spray and saline washes for an extended period of time. You'll likely get a scope in your nose by a physician such as myself to look for evidence of polyps or infection or swelling in the nose that indicate you have a chronic infection. Sometimes a culture will be done in your nose with the scope and sent off to see what bacteria is growing so we can give a targeted long course of antibiotics up to 3 weeks to try to clear the infection. A CT scan may be done to look for areas of infection and whether the sinuses are very involved or not. And if you have had multiple rounds of antibiotics for long courses, then you've been on nasal steroid sprays and gotten allergy tested, and your CT scan still shows significant sinus disease, you may be offered surgery to open the sinuses. Chronic sinusitis is chronic. You will always be treated medically for this, but the point of surgery is to open the sinuses to get them to drain better and to allow for topical saline rinses, sometimes with an antibiotic, to get into the sinuses to clean them out. Oftentimes the small hairs that line the sinuses that beat to clear mucus are paralyzed by the chronic infection, and by getting the sinuses more open, you can clear this mucus better and have relief of symptoms.